Hello, and on behalf of the investigators, it is a pleasure to present the results of the serial study, a blinded, within-patient, head-to-head evaluation of fractional flow reserve and the instantaneous wave-free ratio in serial and diffuse coronary disease. The full paper is available in JACC Cardiovascular Interventions and can be accessed at the link down below. We conducted this study because despite contemporary PCI, residual gradients, ischemia, and persistent angina are unfortunately common. It is therefore crucial to be able to accurately predict the results of our PCI before embarking on any revascularization. This is a particular challenge in serial and diffuse disease, where due to the hemodynamic interaction between stenoses, both FFR and iFR struggle to predict the post-revascularization result. Current practice is to assume that a stent will remove the pressure gradient across a lesion and that the whole vessel FFR will increase by that amount. The same is done for iFR, with the benefit of angiographic co-registration. But these assumptions have never been systematically assessed. Therefore, we conducted this study across 4 centres in the UK, funded by an unrestricted educational grant from Abbott Vascular. The primary outcome was the error between the predicted post-PCI physiology and the actual measured post-PCI physiology after treatment of a single target lesion. 87 patients had FFR and iFR pullbacks performed before and after PCI to a target lesion. Operators were blinded to the results of one modality by randomized assignment, and all data were analysed by a blinded core laboratory. We found that both FFR and iFR overestimate the physiological result of PCI. This was regardless of target vessel, and was despite most procedures being guided by intracoronary imaging, with minimal residual stenosis and minimal intrastent gradients. iFR is often proposed as a solution in serial disease, but it too overestimated the PCI result, albeit to a lesser degree. When using binary thresholds, such as 0.80 for FFR and 0.89 for iFR, the baseline pullback incorrectly predicted an adequate post-PCI result for 1 in 3 patients. For some, this can be resolved with stent optimization or PCI to the second lesion. However, when this is not possible, they will be left with a residual substrate for angina, which may have been better treated with optimal medical therapy or CABG from the very outset. Nonetheless, coronary physiology pullbacks are essential to understand the distribution of disease within an artery and therefore the likely benefit from PCI. We advise exercising caution when the post-PCI result is predicted to be borderline by either FFR or iFR. Further work is needed to help predict the effects of PCI so that our patients can balance the likely benefits with the potential risks of any revascularization procedure. Read the full paper in JACC CVI at the link down below.